Treatment of erectile dysfunctions. In medical term, the erectile dysfunctions is also termed as impotence. So this is the same topic, drug and impotence, and the treatment of erectile dysfunction. The objectives of the lectures are: list the drug that can induce male erectile dysfunction, or we can say the drug induced impotence. Which are the drugs generally commonly responsible for the male impotence? Describe the mechanism of action of the sildenafil. Plus pharmacokinetics of the sildenafil, route of administration, dose, half-life, metabolism, and excretion. Clinical uses, adverse drug reactions, cautions and contraindications, and how to monitor the patient using sildenafil. Let us see the objectives one by one. First one is, what is erectile dysfunction, and list the drug that can induce male erectile dysfunction, or we can say the drugs which can induce impotence. The erectile dysfunction is defined as the inability of male to attain and maintain erection of the penis sufficient to permit satisfactory sexual intercourse, or the performance is termed as erectile dysfunction, inability. It is an inability to attain plus maintain the erection of penis is termed as erectile dysfunction. Now, what are the drugs which are generally responsible and commonly used drug in the older peoples, which is responsible for the erectile dysfunctions? Generally, the first category is diuretics. Diuretics is the mainstay of the drugs in the management of hypertension. If the patient is more than 75-year of old, 80-year of old, and diuretics is the mainstay in the management of hypertension, in the management of the lower limb edemas, and includes the thiazide diuretics and the spironolactone, which is called potassium sparing diuretics, or we can say aldosterone antagonist. Then sympatholitics, methyl dopa and clonidine. Methyl dopa, these are the centrally acting drugs, and these are clinically used in the management of hypertension. Clonidine is also used in the management of the, yes, increase in the blood pressure, management of the hypertensions. So sympatholytic drugs include methyl dopa, clonidine, thiazide, and spironolactones. These are the both categories of drugs are used to manage the elevated blood pressure. Plus, addition to these two categories of the drugs, the beta blockers include propanolol, atenolol, metoprolol, pindolol, timolol. All the categories of the beta blockers may induce impotence. These three categories, plus here the direct vasodilator hydralazine, which is causes the vascular dilation and used in the management of the hypertension. So plus addition to this calcium channel blocker, nifedipine and verapamil, and as we know that The calcium channel blockers are also mainstay in the management of the hypertension in the elderly more than 80 years of age. The mainstay is calcium channel blocker and diuretics. So these four categories of the drug: diuretics, sympatholytic, which are the centrally acting drugs, beta blocker, uh, direct vasodilators, and calcium channel blockers. These all categories of drugs are used in the management of elevated blood pressure, management of hypertension, may responsible for male erectile dysfunctions. Plus the antipsychotic drugs, the drugs which are used in the management of psychosis, phenothiazine, anxiolytic drugs, these are the sedative hypnotic drugs in the treatment of anxiety. These are the drugs which produces the sedations, includes the barbiturates and benzodiazepines. An anticonvulsant drug in the management of the epilepsy convulsions, carbamazepine, phenytoin. These three categories of the drugs which are used in the central nervous system disorders, including psychotics, anxiety, convulsions, are responsible for male erectile dysfunctions. And the cimetidine and the ranitidine, these are the histamine 2 receptor blockers used in the management of the hyperacidity and the management of the peptic ulcer, may leads to male erectile dysfunctions. And we know that these are the commonly used drug to manage the blood pressure, to manage the central nervous system disorder, and acidity related to GIT. These are commonly used drugs and may responsible for the male erectile dysfunctions. Now, which are the drugs are used to treat the erectile dysfunctions? Generally, the drugs are used to treat erectile dysfunctions are sildenafil, vardenafil, tadalafil, and avanalafil. But the most commonly used drug is sildenafil, and today we will discuss about the sildenafil. All the objectives are related to sildenafil. Let us see about the sildenafil, how it act. First one is mechanism of action, how it used in the management or to treat the erectile dysfunction. It inhibits the phosphodiesterase 5, the enzyme. So sildenafil is an inhibitor of phosphodiesterase 5. This question may be useful for your MCQ. The mechanism of action of the sildenafil inhibits the phosphodiesterase 5 enzyme. After inhibition of the phosphodiesterase 5 enzyme, it may leads to increases the blood flow to the penis, increasing CGMP, cyclic guanosine monophosphate, to allow smooth muscle relaxation in the corpus cavernosum and allowing inflow of the blood. So, in summary, This sildenafil increases the blood flow to the penis, and it includes the use of phosphodiesterase 5 enzyme. It inhibits the phosphodiesterase 5 enzyme. We can say PDE5 inhibition may leads to increase the blood flow to the penis. And second mechanism, it also increase the CGMP, and this increase in the CGMP, it leads to the smooth muscle relaxation in the corpus cavernosum in the penis and allowing inflow of the blood. Pharmacokinetics of this sildenafil: absorption, generally it has bioavailability of 40%, peak plasma time 30 to 120 minute. So it is recommended to take this medication 1 hour before the sexual performance, because the peak period is about 30 to 120 minute. Onset of actions, it will start after minimum 30 minutes, because we know that the dissolution rate and the disintegration rate in the GIT is responsible for the onset of action. So minimum 30 minutes is before patient can or person can take this tablet before the sexual performance. Or avanalafil, generally minimum 20 minutes should take before the sexual intercourse. This drug is metabolized by the liver CYP3A4. The most amount of the drug is metabolized by cytochrome 3A4, and minor amount is metabolized by the cytochrome P2C9. Now here the role of metabolism is very important. If it is metabolized by the cytochrome P450, we will see what is the drug-drug interaction in the metabolism in the next step. Elimination, it is generally eliminated in the feces 80% and the urine near about 13%. The half-life, the parent drug half-life is about 3 to 4 hours. What is half-life? Half-life is half. Half means 50, and life means time. We can say the time required to eliminate 50% of the drug from the body is called half-life, and it is near about the, for the parent drug it is near about 3 to 4 hour, and for active metabolite it is near about 10 to 70 minutes. What is the dose and route of administration? Generally, 50 milligram is an normal dose for normal adult. 50 milligram by oral route. It should be taken by the oral route 1 hour before sexual activity, and the dose may be increased to 100 milligram or may be reduced to 25 milligram depending on the effectiveness and tolerance. And please take note, it to be not exceed 100 milligram per day. So the normal dose is only 50 milligram by oral route. Now, in which conditions we need to reduce the dose to 25 milligram, or we can say 50% reduction in the dose, we will discuss in the next step. What is the clinical uses? It is generally used to treat erectile dysfunction, but in order for sildenafil to be active, sexual stimulation is required. The adverse effect, common adverse effect are seen headache and the dizziness are the very common adverse effect. Headache and dizziness. Then the flushing, we can say hot flush. Regarding to the GIT, dyspepsia, visual disturbances, there is and some blue green vision. Yes, we will discuss this in the precautions, why there is a blue green vision after taking the sildenafil. Nausea in dyspepsia related to the GIT. Where is the page 3? Just a minute. 2. Yes. Then insomnia, dizziness, skin rash, epistaxis, we can say bleeding from the nostrils, and nasal congestion. These are the common commonly reported adverse effect, common one, but not the serious one. Let us see what are the contraindications for the use of sildenafil. If the person having documented hypersensitivity with the sildenafil, plus there is and the contraindications for the co-administration with nitrates and nitric oxide, because nitrates and nitric oxide may be responsible for vasodilation, and this may leads to the potentiation effect of nitrate and nitric oxide, which may leads to severe hypotension. So co-administration with the nitrates and nitric oxide like nitroglycerin should be avoided. This drug is contraindicated in some disease conditions: uncontrolled hypertension, severe congestive heart failure, because the main vasodilation, the effect of sildenafil is vasodilation, and due to vasodilation, there may be decrease in the blood pressure, we can say hypotension. Due to hypotension, we have to avoid in the use of the severe congestive heart failure, then unstable or symptomatic angina, recent myocardial infarction or stroke within past 2 weeks, severe valvular heart disease, high risk cardiac arrhythmias, obstructive hypertrophic cardiomyopathy. These all contraindication related to the heart patient. So indirectly, the sildenafil should be avoided in the person of the cardiac, or we can say cardiovascular disease. Plus it should be avoided in severe hepatic impairment, because if there is a liver cirrhosis or severe hepatic impairment, the drug is not able to metabolize and drug may remain in the body, which will create the severe adverse effect. And in the patient of hypotension, it should be avoided. What are the cautions should be taken during the use of sildenafil? Use in patient taking with other medical product. Yes, now we know that the sildenafil is metabolized by the cytochrome 3A4. Okay, and if we use the other medication which inhibits the cytochrome P3A4 metabolism, we can say inhibitors of the cytochrome P3A4. Example, ritonavir, which is antiviral drug, ketoconazole, antifungal drug, itraconazole, antifungal drug, erythromycin, antibacterial, and cimetidine, the used in the management of hyperacidity. If these drug the patient is taking with the sildenafil, what will happen? Because these drugs inhibits the enzyme cytochrome P3A4, and if there is an inhibition of enzyme, the drug will not able to metabolize, not able to metabolize, not able to excrete, not able to excrete. Where is the drug? Drug in the body and may leads to adverse effect. For this purpose, if the patient is taking concurrent some other medications, which are the cytochrome P3A4 inhibitor, should reduce the dose of drug. So sildenafil 25 milligram tablet may be more suitable for these patients. No need to take 50 milligram if the patient has to take this drug. Important is taking the drug antifungal, antiviral, erythromycin plus for the acidity, reduce the dose of drug because it will be not able to properly metabolized. Plus it also elicit the vasodilator properties resulting in the mild transit decrease in the blood pressure. So patient of the hypotension should be, great caution should be taken and not to be taken with other phosphodiesterase 5 inhibitors, as it will may potentiate the action or may produce adverse effect. Sildenafil cautions of the sildenafil. Sildenafil can cause dose related blue green vision. Why? We can say sildenafil makes your world blue. All color is blue. Why? Because sildenafil inhibits the phosphodiesterase 5 and 6, also 6, and this 6 number is responsible for the blue green vision, because phosphodiesterase 6 increases the sensitivity of the rod cells, and if here the phosphodiesterase 6 is inhibited, decreases the sensitivity of the rod cells in the eye, and decrease in the sensitivity to the rod cells of eye makes the person world blue. We can say makes your world blue. So rod cells are most effective at picking up the blue and green light. So these cells are not able to pick up the blue and green light because of decrease in phosphodiesterase 6. Plus, if the person is having known hereditary degenerative retinal disorder such as retinitis pigmentosa. What is this? A minority of these patients have a genetic disorder of retinal phosphodiesterase. They are already deficient in the phosphodiesterase, and if you are taking this drug with known hereditary history for retinal pigmentosa, it will increase the problem including blurred vision. Plus it should be avoided in the patient of the active peptic ulceration, history of bleeding disorder or active peptic ulceration, because it may generally the sildenafil is also having anti-aggregatory effect, and due to anti-aggregatory effect it may causes some sorts of bleeding in the patient of peptic ulcer. And plus, if the patient is with the severe renal impairment, creatinine clearance is less than 30 ml per minute, in that case, if there is a renal impairment, the drug is not able to excrete properly, that's why reduce the dose. So 25 milligram tablet may be more suitable for the patient of renal impairment. And the last objective, describe how to monitor a patient using sildenafil, because the most common problem is hypotension, visual disturbance, and tachycardia. So monitor for the patient of the blood pressure, visual disturbances, and tachycardia. Thank you very much.